Hi everyone, in this video we'll study the topic compliance and regulatory in medical coding. It is a vast topic and you will get only 3 questions in your exam from this section. So I have made this video for you to understand important things which will be asked in your CPC exam. This is going to be very important for your exam. Further, in the upcoming videos we'll also solve questions related to compliance and regulatory. So watch till the end and don't forget to like, share and subscribe to my channel. So let's start. Start taking notes when I'm explaining. It will be very easy for you to remember the concepts. As I said earlier, from compliance and regulatory, you are going to get 3 questions out of 100 in your CPC exam. From compliance and regulatory, you'll get questions from Medicare Parts A, B, C and D, applying coding to payment policy, place of service reporting, fraud and abuse, NCCI edits, NCD, LCD, HIPAA, ABNs and RVUs. So first you need to know what is compliance and regulatory. Regulatory compliance is a critical aspect of the healthcare industry. So it has regulations like HIPAA, OSHA, FWA and general compliance requirements that ensure high quality care. So what is the role of these regulations? These regulations aim at protecting patient privacy and worker safety and preventing fraud, waste and abuse while improving operational efficiency. This is just for your understanding so that you know what is compliance and regulatory. So what are the different types of payers in healthcare? This is important. The 3 main types of healthcare payers are commercial payers, private payers and government or public payers. What they do? They provide clients with health insurance plans and coverage for health-related services. So that is the main role of payers in healthcare. Now let us see what is government or public payers. That is government-funded health insurance plan. Under that we have Medicare and Medicaid. So these two come under government-funded health insurance plans. So what they do is they set amounts that they pay to healthcare providers. So that is Centers for Medicare and Medicaid Services, CMS. They will ask you what is the full form of CMS, that is Centers for Medicare and Medicaid Services. So what does this CMS do? The Centers for Medicare and Medicaid Services provide health coverage to more than 100 million people through Medicare, Medicaid, the Children's Health Insurance Program and Health Insurance Marketplace. Now let us learn what is the difference between Medicare and Medicaid. Medicare is a federal health insurance for anyone aged 65 and older and some people under 65 with certain disabilities or conditions. And Medicaid is a joint federal and state program that gives health coverage to some people with limited income and resources. Please remember this. I am focusing only on the main things that will be asked in your CPC exam. You should know what is Medicare and what is Medicaid. Now parts of Medicare. This is very important. So Medicare has 4 parts. Part A, Part B, Part C and Part D. Part A helps cover inpatient care in hospitals, skilled nursing facility care, hospice care and home health care. So you have to remember what does Part A cover. That is inpatient care, skilled nursing facility and home health care. Then Part B helps cover services from doctors and other healthcare providers, outpatient care, durable medical equipment like wheelchair, walkers, hospital beds and other equipment and many preventive services. So what is Part C? A type of Medicare approved health plan from a private company. So this helps cover most of your Part A, Part B and drug coverage, that is Part D. Now let us see what does Medicare Part D cover, that is mainly for drug coverage. Part D helps cover the cost of prescription drugs including many recommended shots or vaccines. In your exam they may ask what does Medicare Part A cover, Part B cover, Part C, Part D, etc. So you have to know which all services come under Part A, B, C and D. Next important thing is Advance Beneficiary Notice. So what is Advance Beneficiary Notice? It is notice a provider should give you before you receive a service. Okay. That is when your provider has reason to believe that Medicare will not pay for the service. And an important thing in ABN is that an ABN must be signed by the beneficiary patient prior to the procedure itself. The notice must list the reason why the provider believes Medicare will deny the payment. Next is HIPAA. The full form of HIPAA is Health Insurance Portability and Accountability Act of 1996. This is an important abbreviation. Please remember this. So what is HIPAA? HIPAA is a federal law that required the creation of national standards, that is to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. So who issued the HIPAA? US Department of Health and Human Services issued the HIPAA privacy rule to implement the requirements of HIPAA. Next is HIPAA privacy rule. The privacy rule standards address the use and disclosure of individuals' health information known as protected health information. They may ask you, what is PHI? PHI is protected health information. So there is a privacy rule that addresses the use and disclosure of individuals' protected health information by entities subject to the privacy rule. So these individuals and organizations are called covered entities. The privacy rule contains standards for individuals' rights to understand and control how their health information is used. And second, a major goal of the privacy rule is to make sure that individuals' health information is properly protected. And the privacy rule permits important uses of information while protecting the privacy of people who seek care and healing. Next important thing is, what are covered entities under HIPAA? So, the covered entities are healthcare providers, that is doctors, clinics, pharmacies, health plans, healthcare clearing houses. So, what are clearing houses? Those are entities that process non-standard information they receive from another entity into standard format. And next covered entity is business associates. Next is RBRVS. So, the full form of RBRVS is the Resource-Based Relative Value Scale. So, what is this? It is a physician payment system used by CMS and most other payers. So, RBRVS was implemented in 1992. There are three components of RBRVS, that is physician work, that is 52% of the total RVU, total relative value unit, and practice expense, that is 44% of the total relative value, malpractice, that is professional liability insurance PLI, which includes 4% of the total relative value. Next is PQRS, that is Physician Quality Reporting System. So this was established by Centers of Medicare and Medicaid Services. What does PQRS do? It encourages healthcare providers to report information on their performance. The main primary objective of PQRS is to encourage healthcare providers to focus on quality rather than quantity and to facilitate informed decision making by patients. Next important thing is benefits of compliance plan. Compliance practices help identify and address financial risks, ensuring accurate financial reporting and reducing the likelihood of financial irregularities or fraud. So, compliance plan helps in prevention of fraud and it also helps in accurate payment of claims and there will be less billing mistakes. So, these are the benefits of having a compliance plan. Next is fraud and abuse. This is very important. So, let us see what is fraud. Fraud is an intentional deception or misrepresentation that someone makes, knowing that it is false. So what it could do, that could result in an unauthorized payment or benefit. So this is considered as fraud, regardless of whether it is successful. Fraud means bill is high for less service provided. So the examples of fraud may be billing for services that were never rendered, misrepresenting who provided the services, altering claim forms, electronic claim records or medical documentation, and falsifying a patient diagnosis to justify test, surgery or other procedures that are not medically necessary. Next, what is abuse? Abuse typically involves incidents or practices of providers that are inconsistent with accepted medical business or fiscal practices. These practices may directly or indirectly result in unnecessary cost, improper payments or payments for services that fail to meet professionally recognized standards. Abuse means usually billing in error. The examples include misusing codes on the claim and waiving patient copays or deductibles and overbilling, or billing for items or services that should not be paid for by the FEHP program. So mainly you have to understand what is fraud and what is abuse. Fraud means the bill is high for less service provided, and abuse means they are billing in error and they are misusing the codes on the claim. Next is NCD, LCD and MAC. What is NCD? National Coverage Determinations. So these are national policy granting, limiting or excluding Medicare coverage for a specific medical item or service. So NCDs are developed and published by CMS. Next is LCD, Local Coverage Determination. All these abbreviations are important. So what is LCD? It is a decision made by a Medicare administrative contractor on whether a particular service or item is reasonable and necessary. Next is MAC. What is MAC? Medicare Administrative Contractors. So they develop LCDs and process Medicare claims. MACs develop an LCD when there is no national coverage determination. MACs develop an LCD when there is no NCD. This is important. Next is HITECH. What is HITECH? Health Information Technology for Economic and Clinical Health. So this was created in 2009. So what it does is it stimulates the adoption of EHR, that is Electronic Health Record and Supporting Technology in the United States. It was enacted as a part of ARRA, American Recovery and Reinvestment Act. Next is clearinghouse in healthcare. What is a clearinghouse? It is a middleman between a healthcare provider and a health plan that checks claims from healthcare providers to ensure they don't contain errors before forwarding them to a health plan for payment. So what is the benefit of having a clearinghouse? To check for accuracy, it reduces workloads for both healthcare providers and health plans and accelerates the payment of claims. Next, what is NCCI? National Correct Coding Initiative. CMS developed the NCCI program to promote national correct coding of Medicare Part B claims. CMS owns the NCCI program and it is responsible for all decisions regarding its contents. Next important thing is Copay and Co Insurance. This is very important. Copay is a fixed amount paid to your medical provider for services. So it can apply before and after you reach your deductible. What is co-insurance? It is a percentage of the total cost. Applies only after you reach your deductible. So copay is a fixed amount and co-insurance is a percentage of the total cost. Now let us see some important abbreviations from compliance and regulatory. All these are very important for your CPC exam. So first is ABN, Advanced Beneficiary Notice, NCCI, National Correct Coding Initiative, APC, Ambulatory Payment Classification, OIG, Office of Inspector General, ASC, Ambulatory Surgical Center, EOB is Explanation of Benefits, DRG is Diagnosis Related Group, PHI is Protected Health Information, PQRS is Physician Quality Reporting System, EHR is Electronic Health Record, AMA is American Medical Association, ARRA, American Recovery and Reinvestment Act, HMO is Health Maintenance Organization, OCR is Office for Civil Rights, NPI is National Provider Identifier, PA is Physician Assistant and NP is Nurse Practitioner. Take a note of all these important abbreviations. So that's all regarding important compliance and regulatory notes. In the upcoming videos, we'll solve important questions related to compliance and regulatory. So stay tuned.